Good morning, and welcome to this month's Oshner Philanthropy Donor Conversation. I'm Dr. Whitney Hardy, and I am a family medicine physician from Oshner West Bank. I'm also the provider chair of the Oshner Able Resource Group. This month's theme is Minority Health Awareness, with the theme of active and healthy. Now, while the words may say Minority Health Awareness Month, we know there's nothing minor about the communities that we serve. We're thinking about our African American, Hispanic, Native American, LGBTQIA plus communities and other at-risk communities. And we know during the COVID-19 pandemic that the health of these communities has come to the forefront of our minds. We're here to talk about today what funding with the Oshner resource groups can do with the funding, and what funding given to these groups can be used for. And with me, I have two very important people. I have the IS supervisor and representative from the Pride Resource Group, Rose Ruba, and I have Jacob Evans, who is our diversity and inclusion representative, program manager, and also representing ABLE for me. Um, just to get started, uh, just to ask you all, when you think of the minority health theme and minority health awareness, what are some thoughts that come to mind for you?
Rose, would you like to go first, or would you like me to jump in?
You could jump in, Jacob.
Well, thank you, Dr. Hardy, and everyone else who put this important forum together. So the first thing that comes to mind when looking at minority health is that we have to bring it to the forefront of our healthcare strategy and call to action, not just during the month of April, but year round, right? And so we have an important opportunity as the largest healthcare provider in this region to make sure that we are paying attention to what is the data saying on how do we shift our center of focus from health disparities to more of a health equity. And we know that there are a lot of challenges based upon race and so forth. But the key is around cultural awareness, education, right? How do we give our clinicians, all of our clinicians, everyone that touches the patient experience in some way, shape, or form, the understanding of how to treat all of our patients in a more equitable way so that we are making sure that we are treating the person and not just everyone the same. And so I'm just so glad that this is at this is in the global spotlight more than it has ever been, because we are going through several pandemics, and I think I'm very thankful that we have this type of forum and the right people here at the right time focusing on this important need.
Thank you, Dr. Hardy, as well. For my response, we're focusing on definitely the employees and the effects of our community. How can we work together to make a difference? No matter how big or how small, whatever we're facing, we want to go ahead and work together and know that we can make a difference out there.
Absolutely. I think both of you all bring up some really great points. I think it is very great that we work for an institution that gives us the opportunity to raise money and have capital to be able to use for the communities that we are passionate about. So, and speaking of working together, can you both shed some light on the Oshner resource groups and kind of give more of an overview on how these groups could have access to this funding and, what we could do with this funding? Um,
So one of the greatest ways that we've expanding soliciting donations from all of our employees is we created through our partnership with the philanthropy department. All of the resource groups were afforded the opportunity to create their own unique donor link in regards to we refer to it as an innovation fund. And so this opportunity here allows people to donate in more of a virtual capacity, given our current social distancing guidelines. And so we've done creative things such as created Amazon links with registries for folks to handpick the items based upon the current need of the population that we're serving. And those items are able to just be very easily delivered to all of our regional campuses, right? So as a system, we support not only our system level corporate initiatives, but all of the unique needs of all of the regions that we represent. And so we are very thankful that the philanthropy department answered our call to action to help folks donate in a more creative and innovative way so that we can all do our part. And so we are tremendously grateful for all of the ongoing donations that come around year round to support all of our patients from all of our diverse communities.
We are facing the challenges of the COVID right now, but our creativity of what we can do to help service the employees in our community has shown really, it shined. So with us, with the LGBTQ community, we look at doing partnerships in our community. We look at actively involving our employees in virtual matters and being able to keep everybody engaged and keeping everybody in touch with each other to feel that we're still together through all this.
And I do want to add, with the Ochsner Able Resource Group, we have been putting together a network of our providers, just kind of collecting information on what community activities they're participating in. So that way we can use these funds to support them. We have a lot of our physicians that are involved in mentoring activities, physicians involved in community outreach. And so as provider chair, one of the things I've been passionate about is gathering those resources together, because we know that it is very important to have representation among our communities, and that it's important that the communities know that Ochsner is here to serve them and that we have their best interests at heart. Now, whenever we talk about interests, we know that we all want to be healthy, right? We think of active and healthy. And what does that mean for our communities? Because we know that as health evolves, it's more than what happens inside the clinic or inside the hospital. Health also has to deal with your zip code. It has to deal with your job. It has to deal with stress factors. So what are some ways that we can think of, as an institution going forward, to use our funding to really create healthy communities when we think of active and healthy?
Yeah, I think you highlighted some key buzzwords that really inspired my thoughts and how I wanted to respond to this. And so one of the things that you said is that we all realize that we're operating in this unique world where we're dealing with a lot of different stresses that did not come in a pre-COVID pandemic. And so, you think about the work-life balance, right? Your lifestyle behaviors. A lot of that is triggered by what are the resources around you. And so I think one example of how our funding can support this is that we know, based upon what zip code you may live in, is that there are a lot of food that is around you that do not provide, healthy eating options. And so how do we bring those healthy resources to the neighborhood, right? How do we maybe stand up some food markets or what have you, things of that nature, so that we can help our communities gain more access to healthier eating options, so that they're not restricted to some of these social determinants of health that really drive our health disparity numbers down in a more unhealthy fashion. And so it's examples of that. It's the schools that we are building. As you all know about the Ochsner Discovery School, putting them in neighborhoods where we are requiring that a percentage of those students come from those neighborhoods with free access to tuition, cost-free education. And so it's examples of that where Ochsner is saying that what we take a stance on matters, what we do matters, and we play an important role in making sure that we bring equitable resources to all of our underserved communities?
It's a really good question, and how we get involved is within our community is creating that relationship with other organizational groups. Also with the pandemic, we have restrictions of having community involvement. So Ochsner is staying involved with helping these events by making donations and helping them keep going forward, just to help through all these struggles right now. For the employees themselves, definitely it helps for us to know that we listen to them, that when they do need help as an employer, we do offer options for the employee, that if they do need any type of assistance, that we're able to assist them.
Yeah, and I think that you bring up a really great point about when we focus on health, we're looking at it from the complete perspective, in that we can't just focus on what's outside of Ochsner, but we have to think about the health of those that work for the institution, because we have to take care of the caregiver, right? And that is really important, as we've seen a lot of our Asian American colleagues have been facing increasing discrimination during the COVID-19 pandemic as well. To your point, Jacob, I think it's very important to highlight that one of the things that the resource groups intends to do with this funding is to use the data that's being collected by our institution on the social determinants of health as a way to kind of target, how we want to direct the funding. So we don't just want to, collect the money and just kind of put it up. We want to use it strategically, in that, we know where the needs are. We're going to collect this information on where the food deserts are. And, as providers, we have access on, what areas that our patients are living in that have, poor control of hypertension, or where the health disparities are coming from. So it's all about being strategic, but to Rose's point, being centered on the whole person, and I don't think we could talk about this month being Minority Health Awareness Month without highlighting that in the African American community, this particular week is Maternal Health Awareness Week. We do know that in the state of Louisiana, we struggle specifically with maternal health and having a very high morbidity and mortality rate. And I know that, Ochsner has a lot of work that's being done around that, especially with our goal to improve the health of the state in our 40 by 30 campaign. Can any of you speak to that? Do you have any thoughts on that as this relates to this conversation?
Yeah, I think first and foremost, I think Ochsner has realized that, when you talk about this topic of health, to not do nothing is to really say it's not my problem, right? And we're all affected, either directly and indirectly, because these are our neighbors, these are our family members, these are our friends, these are our loved ones. And so, to step up and to partner with our local and state government agencies, other healthcare players in the industry, and to make this bold move to move from 49 to 40 by 30. It's us saying that no longer are we going to be complicit, no longer are we going to make excuses. This is about, how do we break down structural systems that do not provide equitable access to healthcare? How do we educate people on how to change, lifestyle habits that affect their health outcomes, right? And making sure that we are educating all of our diverse communities, whether you are a person of color, LGBTQ plus, an individual with disability, our veterans, and so forth. How do we make sure that we are looking at data that speaks to where are the cultural deficiencies in those regards, and how do we educate and put the steps out there to help us improve the overall quality of life for all? And so it takes all of us, and Ochsner is not going to do it alone. And so we're developing a lot of partnerships, and we're going to those zip codes, as you mentioned, by making sure that we're standing up community health centers where all of us can have access to a primary care physician, regardless of your healthcare need or what have you. And so I'm very excited that you're going to see a lot of community health centers, just to use that as an example, standing up in the areas that really need the more equitable access to healthcare.
For the LGBTQ community, Ochsner is relentless when it comes to delivering the comprehensive and respectful care to all of the patients regarding the sexual orientation or gender identity. We at the LGBTQ community created a Ochsner healthcare website. So the LGBTQ community can go to this website and easily be able to find different avenues that might be where they need to focus on. For an example, they might go to just a men's health. They might go to an adult transgender health. They'll be able to choose even a spiritual care, the LGBTQ experience providers. So it gives an opportunity for our community to be able to find resources at Ochsner to help service their healthcare needs.
Yeah, I've used that website that you're talking about, especially when trying to help my patients navigate this healthcare system, because I may have someone who is transgender and they want to know, well, what providers can help me continue my hormone therapy, or what psychiatrist would be able to cater to my needs. So it's having things like that that is so important in building that community of trust, and being able to have access to a primary care physician. Because I know as a primary care physician, we value relationship. I joined primary care because I wanted to build that relationship with my patients, and that relationship is long lasting. And so one of the things that I appreciate about Ochsner is that their goal is to give us the tools as primary care physicians to be able to move the needle on these health disparities, because that is so important that once you build the relationship, you can help your patient create a lifestyle of health. And I think that, ultimately, that's what we're all working towards, and I think the beautiful thing about the Ochsner resource groups is that this is a community of employees within Ochsner that, have united behind a cause and that want to create change, stemming from the organization that they work for.
How you self-identify, whether you self-identify with a specific population or you just have a vested interest in a selfless commitment to servicing and helping uplift each other, we all have one common goal, and that's to not only help us understand how we are all unique, but how do we value the employee, right? And so that is how we that is our Ochsner Resource Group platform, is to help the overall Ochsner community become more inclusive. And through the intersectionality of all of our identities, we're able to understand that we have more similarities than differences. And that is where our focus areas come in, whether it's on a community outreach in a philanthropy point, which is why we're here today, because it takes a village to do this work, and we have to be more of a united community, because it is at that point to where we really make a true difference in serving one another.
That's well said, Jacob. I was going to say, as a long-term employee, I've seen the impact of what a difference it does make to Ochsner, serving the employees and the patients. It goes tenfold. It does take a lot for us to make a difference, but we know what our main focus is, and we strive to get that done.
And I think we ultimately know that, when we come together behind a purpose, that, our patients will get better. And when our patients get better, our communities get better. And that's our number one priority. We are patients first. and we're communities first, and I think that's what I think of whenever we think of active and healthy. We want our patients to be living their lives to the fullest, and we want them to be having prolonged life expectancies. We want them to have quality of life. We want them to have, happiness, and to live the lives that they want, living your best life, as we're saying now, and how we can help you do that.
Absolutely. When you walk into our doors, we want you to feel that sense of belonging, right? That community feel, right? It's very important for us to see, hey, where am I represented here? And I think we've made a lot of great progress. Rose mentioned the healthcare website for our LGBTQ plus population. I mean, just tremendous, incredible achievements. I mean, visibility is so important, right? When you're creating that first impression. But I like to personally say that we want to create a first and lasting impression simultaneously, right? And just to be able to just connect with your physicians in so many more unique ways than we've ever thought about before, just lets you know that innovation is always at the forefront of our minds. And I think that's because we have more diverse and unique perspectives, and really this global community that we have embedded here, and how we serve folks from all different cultural backgrounds, from literally all different countries around the world.
And you bring up a really great point. Oh, Rose, I'll let you finish. Go ahead.
I just want to make a quick statement. Thank you so much, Dr. Hardy. Everybody faces so many battles themselves personally and at work, but we don't let that show because we know it's about the patient and the employees. We are so proud to be a part of the community that it's a win-win. So the difference it makes is just so rewarding.
Absolutely. I would agree with that 100%. I did, just to highlight one of the things you mentioned about innovation, Jacob, to piggyback off of that, when we think about all of the things that Asher is doing with digital medicine and, the telemedicine as a part of access points for our communities, and how these communities have different disparities when it comes to access to digital medicine. We may have healthcare disparities when it comes to literacy. We may have other burdens. I do want to mention that, one of the opportunities that we have considered with this funding are opportunities to overcome those disparities. I know that there are already things that are being done to provide access for Medicaid patients with digital medicine, but that, we're aware that we have a hill to climb. But, to Rose's point, this risk is worth the reward, because that's where we get our satisfaction, right? When we meet those needs of our patients.
Yes, I think more than ever, it's become so relevant to really listen to the patient, right, and validate what their experiences are, and just being able to be culturally aware, and then have that awareness result in more greater competency, is going to develop that trust and good rapport that your patient needs, as a clinician, right? And so we want patients to be honest and transparent. And I think when we showcase that vulnerability to be honest with ourselves, and sometimes to say, hey, you know what? I would like to invest more time in getting to understand, what is your unique needs, right? It's that vulnerability to not always have the same answers, to not always have the answers on the first round, but to become comfortable with the uncomfortable, right? That's where we want to go. And I think really that's how you unearth the context clues of how to serve our unique population overall.
At Oxnard, when we service the patient, for an example, with the telemedicine, at Oxnard, we think about how to conquer all these obstacles, but they give it such good thought and they think about all those speed bumps that are going to come along the way and how this will impact the end result. And that's what makes us really stand above and beyond, because we give so much into what resources we have and what options that we have, that we could really think what is the receiving end on that.
Thank you, Rose. Dr. Hardy, I'm sorry to interrupt here. I'm getting a code switch. They're telling us to wrap things up, so I just wanted to give you a heads up.
Okay, no problem. Well, thank you all, for joining me, having this great conversation. I think that we've uncovered some really good points and mutual passions. And I think the ultimate goal is that, healthy patients build healthy communities, and that is our goal. And, we have so many opportunities working for an institution that allows us to build off of the funds that we raise. We appreciate your support. We appreciate our donors. And I just want to say thank you to Rose and Jacob for taking time to be with us today.
It was a pleasure being with all of you and Dr. Hardy. Probably one of the greatest moderator sessions I've ever been a part of. So kudos to you as well.
Yes, thank you, Dr. Hardy. And thank you, Jacob. It's been a pleasure.